Good morning, everyone. Thanks for coming to help me with my very first case plan. I appreciate that you've had a look at it beforehand, and I've already sent you a full detailed account of Clara. And she's a 14-year-old, and my plan is to be transparent, reliable, and to make sure that Clara's case plan works for her using her voice. PTSD is a type of mental illness that follows a stressful event, and the way people react to it is very individual. If you treat it in its early stages, you're more likely to lead to a quick recovery, and you will avoid comorbidity like depression, anxiety disorder. Some of the symptoms include anxiety, overwhelming memories, and both pharmaceutical and non-pharmaceutical treatment can be used. The GP in Clara's case has not recommended any pharmaceutical treatment, so Clara and I plan to use a range of non-pharmaceutical treatments for her recovery. Clara's history has come from the Department of Family and Community Services and Clara herself. She has witnessed domestic abuse. She has suffered physical abuse and neglect. 2 months ago, she was placed with her maternal grandmother because the Department of Family and Community Services intervened after being alerted by Clara's teachers. As seen in the case study, Clara has quite a few predisposing factors because of her history, leaving her feeling helpless and alone. Some pertinent precipitating factors include lack of choice, vulnerability, fear of comorbid issues like anorexia, anger management, and death by heart attack. Her perpetuating factors are her diagnosis of PTSD, her lack of adaptive coping strategies, and her unaddressed childhood traumas. It's very important to utilise Clara's many protective factors, like a good physical health, even though she's slightly underweight, the fact that she's developmentally age appropriate, physically and cognitively, that she's concerned and proactive about her well-being, that her grandmothers and her teachers are wanting to help Clara, which actually may improve her recovery a lot quicker, that she has good problem-solving skills, and that she doesn't resort to substance or alcohol abuse. As well as, we also need to take into account her risk factors like low self-esteem, limited coping strategies, adverse childhood traumas, gender, and that she has no peer support at the moment. Clara said she'd like to participate in a few questionnaires to help with weekly reviews of her progress. I'd like to start Sarah with the MSE and over a few weeks complete the SDQ and DAS-Y and HEADS assessment. Clara would regularly redo these questionnaires so that she can see her positive progress using a variety of informal and standardised assessment techniques should give an accurate overall picture of Clara's mental health. Why the MSE? Because it is an important foundation for how she is at this point in time. It helps me to observe and assess her appearance, mood, affect, behaviour, thought processes, speech, cognition, judgment and insight. It's a dependable technique for unbiased data analysis, and it's age and developmentally level specific. The SDQ is also a good one. It's a national standard for young people and their parents to self-report. It measures emotional symptoms, peer problems and pro-social behaviours, which are 3 issues related to Clara's case, and it's short and simple. Why DAS-Y? Because it's short, simple and concise. It can be completed on a weekly or fortnightly basis, and it will help Clara to discuss how she's been feeling during the past week and compare that to the previous week. Why the HEADS assessment? It's non-confrontational. It may be lengthy, but numerous comprehensive, pertinent questions like Clara's sense of belonging and relationship, moods, home life, eating and exercise and risk-taking behaviour are all covered in this assessment. If Clara's mother is still prepared to be assessed, she could choose an assessment like the Family Assessment Device. It measures general family functioning. However, her first step probably will be through Headspace or Beyond Blue, and then we could decide the most helpful step if she wants more assessing. The non-pharmaceutical treatments Clara and I have put into the case study include cognitive behaviour therapy. It's free and it will deal with her unhelpful thinking. Mood Gym and eCouch, because Clara is very tech savvy, so both self-help tools will avoid and manage anxiety and depression. Canine assisted psychotherapy means we can utilise our centres dog, and that will reduce psychological distress that she might have during sessions. Finally, grounding techniques like breathing exercises, mindfulness, focusing on her 5 senses, which are lifelong skills and will help her at any time with stress. Clara would like to be introduced to Headspace and Beyond Blue. She can ring them, chat online. The grandmother can drive her to the closest centre, and both the grandmother and Clara can be educated through them. Also, if they need help between sessions, they've got a helpline and they can empower them through a supportive environment and hearing other people's lived experiences and stories. Clara and her grandmother want to be involved in the case plan. Her grandmother wants to attend sessions and she wants to educate herself through Headspace and Beyond Blue. The teachers also want to help. They want in assimilating her back into the classroom and helping her develop positive relationships with her peers. Finally, listening if there are any problems at school. As you can see from the slide, measuring the outcomes of Clara's progress is a cyclic ongoing process, starting with an assessment, the formulation of a case plan, utilising intervention measures, the need for evaluation, and then Clara needs to be reassessed, etc. Her assessments will be 2 or 3 questionnaires on a weekly or fortnightly basis. Then, depending on how we both think she's progressing towards recovery, will determine how the case plan is altered. The interventions will also need to be revisited at least fortnightly according to how well they suit Clara and her grandmother and what her specific needs are at any particular point in time. At the end of the week, fortnight, an evaluation by Clara and myself will be made of how she's progressing. Questionnaires will be completed to confirm our thoughts on her progress and the case plan reformulated. I will also be giving you weekly updates on Clara's progress and asking for input regarding the appropriateness of the assessments, therapies, services and other interventions. The key to the case plan is to be curious about everything relating to Clara to get a clear picture. We wanted to focus on her strengths, utilise her weaknesses and support her through different therapies, interventions, families and friends. To continually revisit the case plan and alter it as she progresses and to support her grandmother. There are so many things that I've learned during this course. Self-care, utilising people's strengths, empowering people to use their voice, how and why to develop a case plan, and it's opened my eyes to a whole new world of mental health, healing and recovery, resources that are available, and the importance of encouraging hope for recovery.